is thalassemia? Thalassemia is a blood disorder passed down through families in which the body makes an abnormal form of hemoglobin, the protein in red blood cells that carries oxygen. The disorder results in excessive destruction of red blood cells, which leads to anemia. Anemia is a disorder in which your body doesn't have enough normal, healthy red blood cells. In general, treatments you may receive include blood transfusions, bone marrow transplant, medications and supplements, possible surgery to remove the spleen and/or the gallbladder.
The cause is you get 2 bad genes or 4 bad genes. It depends on what type of thalassemia you're talking about. Both parents affected by thalassemia or mainly thalassemia carriers and inherit bad genes from both parents, you become a patient. So the only way to avoid this family screening and giving health advice, asking thalassemia carriers to get married to normal, so-called without the affected genes. Thalassemia is a non-malignant hematological problem.
Is thalassemia curable?
Thalassemia is not curable, unfortunately, because a genetic disease, as long as your genes are there. What we try to do is, one, extend their life expectancy. The cure is only by bone marrow transplants, but that has a price. So everybody with thalassemia is not suitable for bone marrow transplant, because bone marrow transplant has its own side effect, and even it has a mortality or a death associated with the transplant. So selected patients can go for bone marrow transplants. That's the only way to cure.
How is thalassemia treated?
We treat them like we treat other medical conditions like diabetes, which is not curable, but it is very, very manageable.
And what are the side effects of regular blood transfusions?
There are 2 problems in thalassemia. They need blood transfusions. Number 2 is iron overload due to blood transfusion. So most of the problems come from iron overload. So the remedy is to give blood and at the same time to reduce the damage due to accumulation of ferritin. Particularly looking at end organ damage, you have to screen them for all the organ function and take off iron as much as possible. That is the conservative or the non-invasive management. People who are having severe disease without any benefit from that type of treatment can go for bone marrow transplants.
Is thalassemia life-threatening?
Yeah, it is life-threatening condition, and from the beginning, if you are a thalassaemic major, unless you don't get proper care, without treatment of blood transfusions and iron chelation, the life expectancy is very, very short. With a proper comprehensive care, careful transfusions and management of iron can extend life, but it can not be cured.
How is Lanka Hospitals equipped to treat thalassemic patients?
We have a dedicated hematology ward, clinical hematology ward, where we treat all the blood disorders, including thalassemia and also hematological cancers, all the leukemia, lymphoma, myeloma. There we can support them with blood transfusions, iron chelation, and also because this is a tertiary hospital, we have all the expertise in other specialties where they can look into the organ function. For instance, thalassemia patients on iron chelation need regular eye checkup, so we can get the multidisciplinary approach in their care.